Dear brothers and sisters, Assalamu alaikum. I'm your host, Breed Hussain. I would warmly welcome all the participants of the seminar. We will start this program, inshallah, with Tilawat Kalam Pak. Bismillahir Rahmanir Rahim. Wal Asr. Innal insana lafi khusr. إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر اللهم صل على محمد وعلى محمد. Dear brothers and sisters, we hope inshallah that you and your families are well. We pray that our brothers and sisters who are ill are admitted in the hospitals. May Allah subhanahu wa ta'ala bless them with shifai kamil ajil. Please all recite 3 times Amma Yujib for the quick recovery of all brothers and sisters who are not well. أَمَّنْ يُجِيبُ الْمُضْطَرَّ إِذَا دَعَاهُ وَيَكْشِفُ السُّوءَ أَمَّنْ يُجِيبُ الْمُضْطَرَّ إِذَا دَعَاهُ وَيَكْشِفُ السُّوءَ أَمَّنْ يُجِيبُ الْمُضْطَرَّ إِذَا دَعَاهُ وَيَكْشِفُ السُّوءَ اللهم صل على محمد وعلى محمد. First of all, brothers, on behalf of all the audience, I would like to thank you, the Imamians UK brothers and sisters, for organizing this very important seminar on such an important topic. We have already seen some very good programs, for example, Covid-19 and its impact, a surgery with doctor, then on the topic of financial help and support available from government for our community members during these difficult times. These all programs were organized by Imamians UK during the pandemic to help and support the community. And we are here again with very important topic of the day, vaccine, a solution or a problem. I know there are rumors, misleading social media campaigns, and wrong information about COVID-19 and vaccination. We're not experts, and unfortunately, we don't have access to experts, so we're confused and in chaos. But today, we have brought in the top experts here for you, inshallah. I would like to introduce our panel today, panelist. We have a senior religious scholar, Hujjatul Islam wal Muslimin, Maulana Ghulam Hur Shabiri Saab. Hur Shabiri is coordinator of ISRA International, director Al Mahdi Institute Center, Glasgow, and he is also member of Supervisory Board of Imamians UK. Thank you, Agha, for your time and joining us today. We also have Dr. Qamar Abbas, who is a medical director and consultant in palliative medicine. He is a senior clinical tutor at University of Cambridge, associate lecturer at School of Medicine at Anglia Ruskin University, and also principal investigator at National Institute of Healthcare Research. Thank you very much, Dr. Qamar Abbas, for your time, and welcome to Imamians UK seminar. We also have Dr. Syed Hadi Imam with us today. Dr. Syed Hadi Imam is MBBS, MSc, MPhil. He is a clinical microbiologist at Basildon University Hospital. Thank you very much, Dr. Hadi, for your time, and welcome to Imamians UK seminar. After short presentations from our panelists, we would open up the forum for Q&A, question and answer. You can WhatsApp your questions on 0044-784-6515140. I will repeat it for you, 0044-784-6515140. You can also post them on our Imamians UK Facebook page, or if you are attending our Zoom meeting, then you can either write in the chat box or raise your hand during question and answer session, and we will give you opportunity to ask your question directly to our experts. Now, I would like to request Dr. Syed Kamar Abbas to give us an overview of clinical side of COVID-19 situation. He may explain us the symptoms of COVID, how to get tested, when we should call for help. Is there any treatment available? How the hospitals are doing right now? And also, I would like to share that Dr. Syed Kamar Abbas was also early victim of COVID-19, but Alhamdulillah, he has been completely recovered now. We would also love to hear his personal experience, that how did he combat COVID-19. Dr. Syed Kamar Abbas. Dr. Sahib, you're mute. Abad Bhai, can you unmute Dr. Sahib?
Okay,
Can you hear me now?
Yes, Dr. Sahib, please go ahead.
Okay. Bismillahirrahmanirrahim. Assalamu alaikum to all the brothers and sisters, and thank you very much for such a fantastic opportunity to be with brothers and sisters. I'm sure, well, everybody knows, but obviously long time back, we all have been very active on the ISO front in Pakistan. My background is that I actually am a palliative care consultant, but most of my experience which I will share and was observations will come from my different roles. So obviously I'm attached academically as well as evidence-based practice. So which is my involvement and overviewing of some of the researches. And then as a medical director, because we have been involved in a lot of procurement and administration of vaccines at the moment. So I will just reflect to that. I think what I'm going to do is actually just firstly, let's talk about where are we now. So obviously how the COVID started, where we come from, and where are we now in terms of treatments. I believe then Dr. Hadi Imam will talk about the vaccine. And I'm happy to take the questions about the myths, because that has been quite heavily registered with the departments, like we do in the religious edicts as well. I will take a lot of inspiration from my seniors in the vaccinology, and a bit of disclaimer, people like Peter Hornby, who was the basically the chief investigator for recovery trial, which was the trial for treatment of COVID, and more recently Oxford Zeneca trial, which is led by Anthony Pollard and Sarah Gilbert. So bear with me for a second when I share slides. As we all know, was never in our dictionaries only just about a year ago, I would say. And now it has taken over all our lives. In a humorous way, people have talked about the things the words we never knew, like last year, this time, which are things like coronavirus, COVID, restriction, lockdown, vaccines, and even on a business front, things like furlough. I remember I was sitting in the senior leadership team meeting when our director of HR started talking about the word furlough. And I was frantically going through my iPhone trying to find out what does it actually mean. And now we all know that actually these are the terminology we are getting used to. Coronavirus has taken over all our lives. When it has started, we do not know when. And as you would understand that recently, WHO team has arrived in Wuhan to basically look at what could be the real origins of it. They're all postulations. People have talked about coming from bat or the animal market and things. I am very much evidence-based person. So it's very important for me to make any suggestions which are related to evidence. So I will just go through facts rather than theories here, first of all. So first time documented case of COVID-19 or the coronavirus SARS-2 was diagnosed in November 2019. And that was an interesting thing for us because in January, it was declared a FEAC, which is the Public Healthcare Emergency of International Concern. But then it became a pandemic in late January, early February. WHO declared that, which means that it is in a large part of the world. And even then, the projection was that we should be approaching something like about 50 million cases, and whether we will be getting away with 500,000 to like less than 1 million deaths. Yesterday's data tells us that we have got more than 94 million diagnosed cases around the world. When it started being a part of the team which deals with end-of-life care, we were receiving patients who were diagnosed only clinically. We did not have the access to PCR testing all the time. So we were diagnosing them clinically, but we are talking here, this number is coming from the diagnosed on lab testing. We are now have already gone past 2 million deaths, a very unfortunate milestone. In UK, as per yesterday's data, we have got 3.316 million, or in Urdu language, 33 lakh 16 hazar cases that we have been able to diagnose. And we have seen 87,000 deaths in which COVID was recorded as one of the causes, either the primary or the secondary cause on the death certificate. So people may still have died, but may not be there. Yesterday's at 5 o'clock, we received SITREP, which is situation report of National Situation Report, and the numbers were frantically high. 37,282 patients with COVID-related illness in the hospitals. Highest number ever in NHS history of one single disease. 3,672 COVID patients on ventilators. Again, the highest number on the ventilators ever for one disease, apart from road traffic accidents. So, and even there, that number is a little bit lower than COVID-related people on ventilators. It's not about frightening people, it's just about putting people in perspective. It's also another important thing to remember that right now, our diagnostic criteria is different to what it was in April and May. So we are actually giving aggressive treatment to more patients more quicker. So that could be another reason for us using more ventilators. So how does it start? Again, let's talk about the evidence. Usually it's quite variable how people sometimes you just off color, you feel a bit unwell. In my case, I will remember that it was a Sunday evening, 16-17 April weekend, when I we actually do at home Jamaat together. So basically, I felt a bit unwell during Salat, and after Maghrib, and I said, check my temperature, and it was high. So straight away, I went to my room and locked myself in there. I did not have a cough, which is quite a routine feature. So basically, a fever and cough just means that actually the virus has lodged itself in the upper airway, and it has started affecting the body. Systematically, if it starts getting involved and circulates, then high fever, fatigue, and difficulty in breathing may start happening, which means this virus is in circulation inside the body. COVID is a multi-organ disease. So if it gets complicated, then people can suffer from kidney failure, or deranged liver function. Also, it causes clots in the body. So that's what can happen in more complicated cases. We then also found out that loss of taste and loss of smell was happening in the patients. And if it happened, then 95%, which is 100%, it's just a confidence interval statistically, that if it happens with these symptoms, it is diagnostic of COVID. At that time, we also come across a lot of news. We can talk about it later in the talk. With the benefit of time, I wouldn't go dwell too much on it. But you must have seen these things that we started from coronavirus does not exist. It's a human-made virus, was made in the laboratory. And that all was tested by scientists, and they came up with their explanation. Right now, as I understand, the last we looked at is we're talking about more than 16,000 primary researches and more than 100,000 secondary or the review papers have already been published by scientists all over the world. So lots of evidence and effort has gone to look into it. It's spreading through 5G. On one extreme, we were saying the number of deaths is being hidden and young children are dying, which is completely untrue, and there's a reason for it. Number of deaths, on other hand, spectrum, they were saying number of deaths were exaggerated. And then there was another one, especially we heard that actually people were scared of taking their relatives, maybe not so much in UK, but some other parts of the world. They were worried about taking their family member to hospital because they felt that either doctors were inducing coronavirus in patients or they were actually just making this diagnosis where it was really not relevant and it was something else, but they just made a diagnosis of coronavirus. We also move forward then to look at how are we transmitting? So we got the symptoms and how is it getting to us? And there have been lots of papers published now. In end of June, early July, the largest study was published, which actually looked at thousands of people and the mode of transmission of that and recorded it. And they basically analyzed it scientifically. And that became quite certain that it is through respiratory tract. Before that, we were umming and ahhing whether it is touching of the parcels and with eating and drinking and things like that, or even the blood transfusion or other methods. Now we are pretty sure that actually respiratory tract is the most important way. And it is also through droplet. So meaning I will cough and sneeze and you will receive it. But if we have got a situation where like is very high viral load in the air, like casualty, like intensive care units, where you've got lots of patients with high viral load, which is spread out in the air, then it can be airborne as well. And this is when they found out that it needed a minimum of 1 meter, but 2 meter was definitely something which was aired in all those researches, was a good protective measure. Face masks was born out of that as well. If you remember, there was a bit of WHO said that face masks do not work. Far from the truth, because what the basically initial statement, like in any healthcare research will be, we do not have evidence that face masks work. And that is what people desperately want to do, find evidence. And once they found the evidence based on that systematic review, face masks are heavily recommended all over the world. Eye protection is still up in the air, but we know that for normal people, it does not transmit through eye. However, in the high viral load, we are advised to use eye protection, although the research is not quite clear on this. How do we diagnose it now? So we got it, we have those symptoms, and then there are lots of other testing which are coming out. In UK, you can read on the slide the number of ways we are testing them. But basically, if you do not have any symptom, then lateral flow testing can be quite quicker. Gives you a result within half an hour to 45 minutes. And you will know that actually you are easy. This is the method we are using mostly in care homes to allow visitors there. At the moment, everything is on hold, but that's what it was started. But if you have got symptoms and even the corona test and the lateral flow test is negative, we will go for PCR testing. So we'll take a throat or nasal swab and then we will diagnose you. That false negative rate can be there. False positive rate is extremely low. It's just not very, on practical purposes, you do not see that. If somebody is symptomatic and you have got a positive test, then it is just, you have got coronavirus. Now, antibodies testing, Sirens study just published last week, which told us that if you get it, then you can have antibody for a fairly long time. I was included in that study. So I got ill. I was managed with the help of my colleagues very well. I got quite poorly. And after that, I was put on a study, which is recovery study. Later on, I was moved on to this other study. And basically, they tested my antibodies for a fair number of months. And the results are published now. And they've said that 5 to 6 months later, the antibodies can still be positive. But we also picked up that it start decreasing after that time. So now we moved on to the research on medication. So how do we treat it? So you be tested, you got the symptoms, we got you tested, we want to treat you. And this is where it becomes important to talk about vaccine, which we'll talk in a second. So far, what we have only known from all the avid research is that distancing works. What happens after that? I apologize for this typo here about dexamethasone. It should be THA. But recovery trial started looking at all of the different types of treatments. So firstly, chloroquine, which was touted as one of the top treatments and people started using, actually the treatment chloroquine was tested, hydroxychloroquine, and they found out that it was as good as placebo. They were getting it. In fact, the chloroquine, the people were getting more harm. So obviously because it's a drug, so the other group wasn't getting harm. So they said, well, actually, maybe you shouldn't use it. Then the second trial, which was published by recovery group, was dexamethasone. And we have to be very clear on this. The only place we found that it was working when people started having breathing difficulties and their oxygen level dropped and their lungs started working badly. It is not a treatment for virus. So if you get virus, you get fever, it's not about dexamethasone. It is dexamethasone the evidence tells us that so far that it was working for those people where they were having lower breathing efficiency. So we gave them a steroid, it started healing of the inflammation of the lungs and people got better. So this is the only research which has been found really helpful. As a doctor, for us, it was a godsend because it really helped us a lot. About the patient, before we move them to IT or something, we will be using only for mechanical ventilation, which is the BiPAP. We will use it. Remdesivir was another one which was again flagged up a lot in the world. The studies are out now, no measurable difference. Laponavir and ritonavir were another study, came out, no benefit. Plasma or immunoglobulins, that was another very interesting idea. The studies are out and they are both equivocal. So lots of studies done, but they're equivocal. So meaning some people we are seeing some benefit, some people we are not seeing benefit. If we are seeing benefit, we are finding it hard to predict that it happened because of plasma or they were going to get better anyway, regardless. So that's why it's no conclusion. The last one, which I haven't mentioned here, is ivermectin, which again is a drug out, a lot of interest to all of us, but so far nothing much is coming out. So here we are. We know what symptoms it causes. We know how to diagnose it. We know we could prevent it by staying away from each other. But the last part is, which is the most important point, is actually so far, you know what? Treatments are not working. So what do we do to beat this disease around the world? And this is another thing which actually has shaken us a lot. Again, going back to evidence. The mortality of COVID-19 has varied from the beginning to now. We are looking at some of these issues. We know that in the most vulnerable group, it has increased by 0.4% in this second wave globally. So we were less than 2% at that time. Now we are approaching 2.3% on the vulnerable group. And 14% for those people who are elderly and 85 years old. And so we know that it is happening. But here I will share with you some. And so they looked at these people. So who are these people who are ending up in ITU and dying? And they made a list of these things. They said, actually, do you know what? These are the people. We need to shield them. We need to protect them. We need to keep them safe. No matter how close we are to them, if we never went near it, the same virus which will not cause any damage at me at a viral load, I transmit it to you, it will quickly cause some damage to those people. Okay, fair enough, we got it. But 20% of the top 1%, we just found out that we are struggling to know what is happening to them. Might sound very low, 20% of the 1%. But when we are talking about millions of cases around the world, we are talking about real people here. And we are talking about thousands of people here. So still, we really are very, very worried. How is it going to pan out? That actually takes us to the next question. We can't treat it. We do not know how to actually predict even the most vulnerables. Well, most vulnerable we can, but some vulnerables we can't. So how do we prevent everybody, each and everybody around where we are? This is the structure of the virus, as you see, and it will be useful to talk about later. So I will leave four types of proteins. We call it MENS. So membrane and envelope and nucleocapsid is outside, but it's the spike we are worried about, because spike is the one which ties to the proteins and causes the damage. We can talk about it later. So here comes the something which scientists are now moving towards. So we can't actually do that. Let's actually find a way and we can protect the general population. And we come to the idea of vaccine. I will stop here because I believe Dr. Hadi Imam is going to discuss these things through before I can just go on to talk about some myths about it. Thank you.
Thank you very much, Dr. Kamar Abbas, for your well-explained presentation. I hope our audience would get benefit of that, inshallah. Please be with us and we will be back to you during question and answer session. Well, now what are vaccines? Vaccines are a way of artificially activating the immune system to protect against infectious diseases. The story of vaccine begins with the long history of infectious diseases in humans around 1,000 years ago. Although Edward Jenner is considered the founder of vaccinology in the West in 1796, who invented a method to protect against smallpox. Definitely, one thing can be said for sure, that vaccines for these diseases reduce the disease burden greatly. But there are still many questions about vaccination haunting us till today, especially with the reference of COVID-19. Is the vaccine a hoax? Can I trust the vaccine? Should I have vaccine? Is there any conspiracy behind, and what does science say? Today, we have our very important guest speaker, Dr. Hadi Imam, who is working as clinical microbiologist at Basildon University Hospital. Without any delay, I would request to Hadi Imam for his presentation. Dr. Hadi Imam, over to you, Doctor. Doctor, you can unmute yourself, Dr. Hadi. Thank you, Doctor.
Okay, thank you so much. And Assalamu alaikum, all brother and sister. And thank you so much for inviting. It's a great pleasure to me. So as we know that is a corona issue, then the vaccine. So there's a lot of the things are going on. Thank you so much for inviting me as a speaker. So I will start my this sort of little lecture with some presentation. Before that, I'm saying that that is an immunology vaccine and all this stuff is a very dry and topic even for the medical or the scientific background people. But I'm trying to make it as simple to understand everyone. As my understanding here, the people are with the different background. So I will try. If any question at the end of session, you are open to question, ask anything. I'm very happy to answer. So I'm just sharing some slides. So we will start it. Yes, the coronavirus, which is SARS-CoV-2 virus, belong to a family which is known as coronavirus. As you know, virus is in between the living and non-living thing, and which have different families. So one of family is coronavirus, which is well known to the world because of different outbreaks. For example, SARS in 2003, MERS 2012, that is the Middle East Respiratory Syndrome. That is a one of big issue in recent time. And another important thing, that is a swine virus, SARS-CoV-2 in 2009. So they have the same family. They are the RNA virus, as the viruses are the maybe DNA or RNA, but corona family belong to the RNA virus. And it is surrounded by the protein capsid with a spike protein. Mean there is a RNA material which is surrounded with a capsid with a spike protein. As the doctors come and show spike protein, that is an issue, but it also help out to make the vaccine idea. So I will discuss later on. Another thing, how the vaccine works, how the things. So I'm start from the very basic. What is immunity? So immunity means power. I will say the exact definition, the ability of an organism to resist a particular infection or toxin by the specific antibodies. So that is a power. So we have two types of immunity, two of power. One is innate, that is from birth. For example, our skin is a part of our immunity, and we have a different cell in our blood circulation, which will be help out to protect, just like the white blood cells. And the second is acquired immunity. Acquired, we learn it when we in this world, just like we have encounter with some infection, and our body produce something which is known antibody, and to help out to fight with the particular infection. And the second thing, our acquired immunity, which is produced our own body, is vaccine. So as you told us some little bit background about the vaccine, the long history. So I indirectly move that what the vaccine do. Vaccine actually go into the host body, just like we are the host body, and produce the antigen. So how the vaccine works, actually how the vaccine form, there are two major things. One is inactivated beacon virus or bacteria we use to introduce into the body and produce antigen. Second is the genetic material from virus. Just like the inactivate beacon virus or bacteria, that is AstraZeneca and vaccine use this formula to make vaccine, and genetic material, just like the Pfizer and the Moderna vaccine use. How they do? They enter the body, stimulate our immune system, that is our protective system, create the antibodies. Antibodies fight with the infection, and they form also the memory cell. They have information that if this infection will come again, we will fight. In simple, fight and for future infection. So I know it's very difficult to understand with what I have a little video clip, which I took from the YouTube. So I'm just going to move, then we will continue. Sorry. Yes. We inject the vaccine in human being. It enter the body, and our body cell. This is not the COVID, just like the vaccine. I'm telling about the vaccine, how the vaccine works. This is the cell, and which cell grip it, enter this vaccine particle inside it, grip it, and these are formed. For example, this is not exactly for the COVID. For example, this is going for the capsid, and this is the spike, and which will help to fight the infection. So let me move another thing. So sorry, I'm just going to be state how this infection run. Yes, this one. See, if infection carry with different, this is not only about the COVID infection. It move from one infected person to other person. It go inside the respiratory tract, get inside the our lungs, another part of the body. Yes, I just hold this here. I'm explaining that if we are vaccinated, so this virus come but do not attach to it. So there are few more things, but try to simplify it. How the vaccine act. So when we inject the vaccine, antibodies form, and when the new virus come, it will protect to produce the disease inside our body. So let's move to the, again, you can see my slides, yeah? Second thing, what the main target of our vaccine? The main target of our vaccine is it should be safe and effective. Safe for the human being to use and do not do any side effect, major side effect. And how much effective, that is the most important thing, because we are doing all this to protect future infection. For the work on the vaccine ongoing, especially the RNA vaccine, are under development for the decades. The people are working on it for a long time. So that's why it will continue in the corona vaccine as well. So COVID vaccine. So COVID vaccine have task force for the COVID was set up in April 2020. So one thing more, vaccine is not the rocket science, because we already faced this type of the issue. So they start work and they produce vaccine in the December to vaccinate the people. So they work very quickly and follow all the steps. So first of all, these are the safety measure taken. One is preclinical trial and other is a clinical trial. So let me little bit inside of what is a preclinical trial. Preclinical trial usually in the tissue and cell culture, which is taken inside the lab or in some animals. So how the thing is produced, and if it is successful, then go to the clinical trial. The clinical trial means we are the human being, they are going for the trial, the phase 1 trial. The phase 1 trial was taken 20 to 100 healthy individuals. And the main purpose of this phase 1 trial is check the safety in a human being and how the immune system responds. If it work okay, then we move to the phase 2. Phase 2 is more than 100 people as a clinical trial or individuals. And the main target, including the immune response, safety measures, another thing is dose and schedule of dose. Just like few vaccine need 1 dose, some few vaccine needs 2 dose plus booster dose. So they make the formula for that. And the phase 3, that is the most important phase, and in which the thousands of people are involved in different location, in different parts, in different race. So they will monitoring the side effect. And the most important thing is that the people from the different background, different colors they use, and they monitoring the side effect. After that, vaccine is ready to go to the community, just like this vaccine is available right now. So approval of vaccine. We are talking about the UK. So in UK, MHRA, Medicine Healthcare Product Regulatory Agencies, that is an independent regularization. And the other is Joint Committee on Vaccination and Immunization Advice, Department of Health and Social Cares. So both are involved for the approval of vaccine. So they are very highly professional people and very inside of the science and the government policy. So they finalize the things. So approved COVID vaccine right now, there are 3: Pfizer, AstraZeneca, and Moderna. So they are almost all 3 available, or at least 2 are available. 3 is in coming future. Let's talk about the Pfizer vaccine, which is the first one which is available and is the first approved vaccine in the UK. You can say all over the world. The trial consists of 44,000 participants. He's a huge number. Use different locations, and the the best thing is no serious side effect except a few headache, light fever, pain, heaviness, and few more side effects. Pfizer vaccine, how it works is used by messenger mRNA vaccine. So as I explained, the copy of genetic sequence of the SARS virus they use injected in the host. I mentioned in the video, enter the host cell, produce a spike protein of virus in the host cell. Mean when enter the body, it go to the host cell and produce the spike protein on the host cell and produce the immunity and produce antigen. When the coronavirus come into the body, so it will protect it by this antigen. And at then there's no disease produced by injection of vaccine. The important thing, which is I think most prevalent, is a no animals product in the Pfizer vaccine. In phase 2, effective is 90%, 95, more than my 95% effectivity is that is very, very high. So let's move to the other vaccine which is approved in the UK, is AstraZeneca vaccine. And the participant for this trial is 24,000, which is also in different location, and it also not major serious complications. And the method to preparation of this vaccine is totally different. At the start, I told you about the weak virus or bacteria. So this is a weak virus. They take adenovirus itself produce disease, but it is so weakened for this purpose, they do not produce the disease. So this is one of the very traditional old method of the manufacture of the vaccine. And a lot of the vaccine we use, just like in our EPI program, or at the time of birth. So we use the vaccine which is made on this basis. So this is in COVID vaccine, AstraZeneca used the adenovirus, weak adenovirus. We do not produce the disease from chimpanzee source, which contain the SARS-CoV virus antigen. Then the principle is same, enter the host cell, produce the spike protein, stimulate the immunity and memory cell, and protect you for the future infection of the COVID. And the good thing is no disease produced with this vaccine. And again, they didn't use any animals product for the manufacturing of this. The last thing I want to say, this vaccine are safe, effective protection against the COVID-19. And the most important thing I say, BME is high risk of infection and more severe COVID disease because of the social factors. Higher incidence of comorbidities, just like a diabetes in our communities. These factors are complex to control, to be honest, but most effective solution is only vaccine. This is my recommendation. I know there is a lot of the question, so hopefully at the end of the session, we will have a question answer. So you are most welcome. Thank you so much from me.
Thank you very much, Dr. Hadi Imam, for your fantastic presentation. It was, of course, very beneficial for us all. Be with us, and we will start question and answer session in a few minutes, inshallah. Brothers and sisters, I understand you may have some questions about Islamic or religious rulings regarding vaccination. It was very unfortunate that there was a discussion, for example, in Indonesia and Malaysia recently, that whether vaccine is halal or haram. So we have invited our respected scholar, Maulana Ghulam Hur Shabiri, to discuss the Islamic perspective of vaccination and our social and religious responsibility. Without any delay, I would request Agha Hur Shabiri for his presentation. Maulana Ghulam Hur Shabiri sir.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله الذي خلقني ويهدين والذي يطعمني ويسقين وإذا مرضت فهو يشفين والصلاة والسلام والتحيات والإكرام على أشرف الأنبياء والمرسلين وعلى آله الطيبين الطاهرين وعلى صحبه المنتجبين وعلى بقية الله في الأرضين وعلى فاطمة الزهراء سيدة نساء العالمين أما بعد فقال الله الحكيم في كتابه المبين بسم الله الرحمن الرحيم وإذا مرضت فهو يشفين. First of all, I would like to extend my salam and salutation to all brothers and sisters, and especially our honorable guests and experts, doctors, those who have provided beautiful advices to our community today. May Allah subhanahu wa ta'ala bless you for your great advices. And it is, of course, the time to help the community to bring them out from the confusions. I would like to discuss about four important areas. Very first area that I would like to discuss that is any type of viruses or sicknesses, diseases in the history. Of course, we as human history have various times that have passed and the difficult times from the beginning of Islam or from the beginning of Islamic history. And Quran also has mentioned about the sickness and illnesses. And one of the verses that I've recited in the beginning, it is from Hazrat Ibrahim alayhi salatu wasalam, when he speaks praising Allah subhanahu wa ta'ala. All praise is due to Allah subhanahu wa ta'ala, the one who has created us and who guided us toward the right path. And then he says, the one who feeds us and one who provides us when we are thirsty, provides us water. And third, he says, وَإِذَا مَرِضْتُ فَهُوَ يَشْفِينَ. When I become sick and I become ill, Allah subhanahu wa ta'ala is the one who provides me relief. When we look at this verse, it's very interesting for maybe for the doctors as well, that from the aspects of Hazrat Ibrahim alayhi salatu wasalam, when he looks at illness, he considers illness from the human being himself. He says, وَإِذَا مَرِضْتُ فَهُوَ يَشْفِينَ. When I become sick, then he is the one who provides the relief. And that is one of the, of course, discussion that maybe, scholarly discussion. I would not like to go to that. That there's possibility that illnesses are a cause of human being himself, that we cause illnesses. And that is why for the prophets or A'immah alayhi, it's been considered as a weakness to have some sort of illness, unless if there is any special type of the reason and cause. But there are various times that when we see in the text, religious text, where Islam has provided guidelines to the communities when they are in the viruses. Of course, at the moment we are in a virus that have taken over almost all the universe. So let us see what are the guidelines. Of course, many of scholars, they have discussed about that in the past, and I would like to just give a few text from the books. It's been said at the time of Holy Prophet, peace be upon him, it's been said, إِذَا وَقَعَ وَأَنْتُمْ بِأَرْضٍ فَلَا تُخْرِجُوا مِنْهَا. Whenever you are in a city, in a place where you are being engaged in a sickness, then do not exit from the country. So stay over there. That means it can spread in the various places. So this is what we call it today, quarantine. So quarantine is not something new. That is something that is being advised by the Prophet, peace be upon him, or it's been said, فَإِذَا سَمِعْتُمْ بِهِ فَلَا تَدْخُلُوا عَلَيْهِ. If you hear about any of the countries, any of the cities that is going through any illness or there is any disease, then do not enter to that city. So entering itself, it is problematic. So if this is something that our experts, they advise there, that has religious background as well. And also for quarantine, it's been said, فَلَيْسَ مِنْ أَحَدٍ يَقَعُ الطَّاعُونَ فَيَمْكُثْ فِي بَلَدِهِ. Wherever you see that the virus have taken in a city, then you should stay in the city. صَابِرًا مُحْتَسِبًا. And it's really important, brothers and sisters, that we need to be patient. We should not be, going through some sort of distress, and we should change all these problems to the opportunity. It is time that if we are staying at home, so make that as an opportunity. As one of the doctors, I think he was saying that they have Salat Jamaat at home. It's interesting, very nice, alhamdulillah. If we can start having Salat Jamaat at home, having Quran session at home, using this time with the family, and not to waste our time, and be patient. Allah subhanahu wa ta'ala is going to take this pandemic out, and our religious leader here said that this rusty road is going to be towards an end, and we are going to have a time of relief soon, inshallah. And as our doctors are also giving good news for the future. This is about the history. Second thing that I would like to discuss, that is Islam and jurisprudence. Of course, we all know that Islam is a religion that is institutional religion. It is based on the institution, and institution of the religion is knowledgeable personalities and jurists of its the history. In the past history, we had great scholars, and nowadays today we have great religious authorities. But Islam does not like to bound the people into only religiously scholars, but it says that you need to follow and taqleed. When it's been said there, that is very important concept of taqleed. It says that there are two types of taqleed. One is blind taqleed, and another is wise taqleed. Blind taqleed, it means that you follow from the people, those who do not have knowledge. And wise taqleed is that you follow from the experts of any field. So you can see in the past history that our religious scholars, they followed from the experts, like Imam Khomeini, for example. In the past history, we have seen that when he becomes sick, then he's been admitted to the hospital. And whatever doctors they used to advise him, he said that I will follow. I will not say anything. I'm not expert in this field. And in today's world, we have our great scholars like Hazrat Ayatollah Sistani. We have our present leader, Hazrat Ayatollah Imam Khamenei. When he speaks, he refers people towards the experts. He says that you need to follow from the health advisors, and do not make any type of the speculations, but you are supposed to follow. So this is what it means, that Islam, it does not ask us to do taqleed only from marja. It says you need to follow from the experts of any field. Like when your car becomes in a problem, then you're not going to go to the doctor. You're not going to go to Maulana. You're going to go to the mechanic, of course, right? So this is what it's concept of taqleed we need to understand. Yes, there can be some of the cases where if advice of a doctor or advice of any expert, it is going to clash with the religious principles. Over there, of course, we have to be bound to follow the religious advices. But as far as it is going to, let's say, give an example, that alcohol, for example, if medical doctors, they say there's no problem in having alcohol. I don't think that they have said that, but still, if they say that there's no problem with that in having alcohol, and religion, it says that there is problem. So this is clashing actually with the religious principles, and we are bound to follow religious principles. So in ijtihad and taqleed, when we look at that, brothers and sisters, we are a religion that is up-to-date religion, a living religion. And one of the evidences of the living religion, that in today's world, if you've seen the religion that has religiously asked the people to follow in every steps from the health experts. You probably have seen now, of course, we are having this meeting. There is online meeting. We are not wearing the masks, but all our scholars, alhamdulillah, throughout the world, taking from religious scholars like Imam Khamenei and rest of people, they use masks, and our scholars, they have closed their centers. So taking from Hajj, Ziyarat, and all religious places are being closed. So you can see that how Islam has been able to be cooperative with today's world, and it has actually proved that it is a living religion for the world today. It is not the history. It is not a religion that only gives us guidelines for the history in the past, but it is a living religion, lives according to the needs of the world. Third, and important, I would like to discuss, that is vaccine, of course, vaccine in Islam. Then again, what I would like to request, brothers and sisters, that Islam would not give any view about vaccine, but it's going to ask people that you need to see if vaccine is being recommended by the health sector, then you need to follow for that. And you would not see any particular view from any marja, any religious scholars. Yes, you may refer to the recent speech of our leader that I would like to discuss about that. But before that, what I would like to ask brothers and sisters, that at the time of Holy Prophet sallallahu alaihi wasallam and at the time of Amirul Mu'mineen alayhi salatu, our Aimma alayhi salam and Holy Prophet, peace be upon him, they have asked the people to go toward the doctors. I can just give one example, that it was final time of Amirul Mu'mineen alayhi salatu salam, and the poison, it was taking over the body. At that time, Imam Hassan Mujtaba alayhi salatu salam asked that if you can call Tabib. Of course, Tabib, it was a doctor at that time, and a doctor was called. And he gave some advices to Imam Hassan Mujtaba alayhi salatu salam, and he looked at the body, and he said that poison have taken over the body. So it was not Imam Hassan Mujtaba alayhi salatu salam was there. He's an Imam. He could give his knowledge. He has knowledge about that. But Imam alayhi salam, they wanted to actually teach us that you need to follow from the experts. So this is what it is really important, my brothers and sisters, those who are viewing today's program, that when we speak about the vaccine, do not make yourself into the confusions and you hear from either and other, and then you start making some sort of view and basing your view on different types of the people. But you need to make your views according to the health advisors. When we look at this late speech of leader, or some of the messages were there that were voice messages saying that any religious authority has given any view about the vaccine. That's what I would say, that there was no verdict is being given according to the religious authorities. There was no such a verdict being given about the vaccine or against the vaccine. Yes, for a recommendation towards the vaccine and using the vaccine, there can be recommendation. If it's been recommended by the health authorities, then it's going to be recommended by the religious authorities as well. This is one of the principles of our religious seminaries. Whenever intellects and intelligence, it is going to rule about something, religion also, it's going to give the ruling according to that, because our most of the principles are based on the intellect. So when I look at this late speech of the leader, that speech was actually being given for the particular about Iran and Islamic Republic of Iran. It has nothing to do with the rest of the world. The ruling is being given that we do not trust on the companies that are outside, and not trusting on the companies that is actually for Islamic Republic of Iran. It has nothing to do with the people that they should not be trusting on anything. It's not been said that you are not supposed to trust on anything, but it's been said that you are supposed to follow your experts wherever you live. But we, experts, those who are in Iran, they have not recommended to buy from certain countries. So there can be various reasons behind that I don't want to discuss about that. There are various political reasons, and those political reasons are also very well known for those who are a little bit aware about that a country that is going through sanctions from various many years, and you can just imagine that any company or any authority in this country is being sanctioned. So there is a complete animosity that is going on from these countries that are being mentioned. So when this country is going to make a decision, it's going to look at that background, and according to that background, a leader has to decide about that. So I discussed with the great scholars, those who are representative of the Maraji over here, that is there anything to do with this country, the people, those who are living in this country, that there's any recommendation. So recommendation is going to be opposite side, not against. We cannot say that any view of the religious scholar or the leader, it is against the vaccine, but it is in the recommendation of the vaccine. For example, if they said that we are going to buy a vaccine, what it means? It means that they are for vaccine. And if they are making a vaccine in their country, that means they are for vaccine. So all these evidences, they show that vaccine is good if that is going to be beneficial for our health and the health of the people, and it is going to be better for the prevention from any of the sicknesses. I'm not going to take more time. I know that time is short. And of course, there are many questions from brothers and sisters. They may have written in the messages. Inshallah, we'll deal with those questions later on. I ask Allah subhanahu wa ta'ala, may Allah help our community and human being that they can get out of this pandemic, and may Allah provide time of relief again. اللهم عجل لوليك الفرج واجعلنا من أعوانه وأنصاره برحمتك يا أرحم الراحمين والسلام عليكم ورحمة الله.
Thank you very much, and Jazakallah khaira Ghulam Hur Shabiri for giving us insight about Islamic perspective and ruling regarding a vaccination. So without any delay, we are going to start our question and answer session. You can again WhatsApp your question on 0044-784-6515140. It is 0044-784-6515140. Or you can post on our Imamians UK Facebook page, or if you are attending the Zoom, then you can raise your hand and our admins will provide your opportunity one by one to ask the questions. I have received a few questions, and inshallah I will start from those questions on my WhatsApp. Yes, I have a question for Dr. Hadi Dr. Kamar from Mrs. Batul. Should we clean our grocery or not? If someone sneezed on that, can we take the virus while touching it and using our hands? So it is about grocery, Dr. Kamar.
Assalamu alaikum. Thank you very much for the question. First, thank you, first of all, Dr. Hadim, and obviously Agash here. Fantastic talks. Really learned a lot. Going back to the grocery question, I think there was an interesting one, because if somebody has sneezed on the grocery or anything, then the simple answer is actually we should be cleaning it. Yes, we are quite hooked up with the coronavirus at the moment, but we have to remember there are lots of other viruses and bacteria in the world which we can easily transmit. So we should be. There is no evidence, others can clarify me as I understand, for the moment, that actually it is transmitted in any other way. So for example, if it is not getting inhaled, then you shouldn't be receiving it, but you should still be cleaning it, because there are other viruses that you should be still worried about. Islam has also given us a lot of opportunity about washing and cleaning ourselves at all times. I remember actually when they came and they said, well, actually you have to go the fingers when you touch, you clean, you have to go through the fingers to clean it, to the virus, because the virus lodges itself in the, and then you touch the face and everything, it's transferred. And I was reminding myself, how do we do the wuzu? So it's, within Islam as well, we get all these guidance. So please wash it anyway, regardless of coronavirus.
Thank you, Dr. Qamar. Inshallah, we'll be brief to take more as much question as possible. Similar question from Ms. Zara. Does the virus stay on fabric? Like we are traveling in the trains, can it stay on our clothing?
Yes, we know that actually it does. Whether it is high enough to be transmitted inside us or not, that is not proven in the labs. We know that virus can land itself on the fabrics or the hard surfaces, and that's why we need to keep it all cleaned. But whether it can be inhaled later on to cause damage enough, that we do not know. So the advice is still evidence-based, is that actually we should clean the clothes whenever we actually come out, and we should have a proper cleaning and washing and everything before we reuse them.
Thank you. Dr. Hadi, I believe you have answered the question already, but there is a question that are there any haram like pigs, etc. in the vaccine particles? Dr. Hadi, if you unmute.
Yeah, sorry. Yes, I explained just like there's nothing haram. There's no animals product inside it at all.
Mm-hmm.
And you are talking about the pork, yeah?
Yeah.
The question is about the pork. There's
yeah.
nothing about the pork.
Okay. Okay, there's another question for yourself, that there are many vaccines, not only Moderna, Pfizer, Oxford one, but we have heard from China, Russia. What's your view about so many vaccines and which one is better for us?
Okay, so first of all, just like the mechanism of action of the vaccine, Pfizer and Moderna has the same, and AstraZeneca and the Sputnik from the Russia and the Sinopharm from China, they are on the weak, why they use the weak virus. So all depend upon the availabilities. There is a lot of the things in like that. Pfizer efficiency is the most effective, that is more than 95%, more than 90%. Rest are the around more than 70%, just like that. Is all about the, the Pfizer have some issues, just like the temperature, rage, different thing. If this is question for the England or UK, is we do not have any option. If the government allow which vaccine, which allow which vaccine to you, you have to accept it. They have their scientific board and everything. But rest of the world, they have to take decision on their resources. For example, underdeveloped countries, it's very difficult to maintain the cold chain for the Pfizer. All vaccine are useful. It's all about the efficiency. So Pfizer is the most affected, but some issues with their cold chain. So I recommend all according to the needs.
Thank
you, Doctor. Thanks a lot.
Can I interject a little bit in that, if you don't mind? So Dr. Khadim, obviously, also we have to remember that reading the results of it takes a bit of caution, because if they are saying 70% useful, 80%, 90%, what we have to read carefully what is their outcome result. For example, Oxford AstraZeneca was looking at developing a particular level of antibodies. So that is why when they said 70%, whereas Pfizer only looked at developing antibodies. So that's why scientists have to actually still look at that and then basically decide according to their own country. So when we should not get fooled by just looking at, oh, this is 70%, this is 90%, so it must be better than that. It's not exactly like that.
Thank you, Doctor. Meanwhile, can I request any of the admins or brothers in the forum of Zoom, if you can pick up the questions from our chat box, it would be great, because I am trying to pick up questions from the Facebook as well as from WhatsApp. So inshallah, any of brother who can pick up the questions from the chat box, they can ask directly to brothers. I have two more quick questions from the Facebook. Mirza Muhammad Jawad. Question is, how effective these approved vaccines are for new variant of virus? Dr. Hadi?
Yes, thank you so much. Yes, I think it's the most relevant question. Yes, still company are saying this virus or this vaccine is acting for this variant as well. So not in my knowledge has any company say that this is not effective again. So far, Pfizer's and the other companies say, yes, this vaccine is also work against this variant virus.
Thank you. Thank you, Dr. Hadi.
Can I just show a slide which we had before?
Yes, sure.
So if we look at this, and these are the spikes. So basically there are different proteins which are MEN, membrane envelope nucleocapsid. So which is here, and these are the spikes which are coming out. The vaccine, especially the messenger RNA, is going to basically adopting this sort of surface. So that is how it will work. What we are seeing is actually the variation is in other proteins, not the one which actually causes damage. That's why they are saying that so far we have not seen the variant in which the vaccine will not work scientifically, because it's on a different area where actually vaccine is targeted.
Thank you, Doctor.
One question, Tabreed Bhai, can I ask then?
Yes, sure.
It's from the participant, actually, not from me. That can we please shed some light on side effects of people who have taken Pfizer vaccine? So please tell us for dose 1 and dose 2 side effect what has been published. Thank you.
Yeah, any of you, Dr. Hadi or Dr. Kamar, who would like to respond, please?
Okay. Obviously, because it is going to work on the immunity of the person, there are different types of side effects we talk about, the short term and the long term, if I can put it briefly. So the short terms one are the one which can actually have when you elicit an immune response in the people. So first of all, people can have for any drug, you can have allergic reaction, which is a very quick one. Then you can have different delayed reactions. So if you're allergic to a particular thing, which we can be to anything, then we can have a reaction. Very, very unheard, very, very uncommon in these type of vaccines. I know people get worried about the allergic reaction, but if you look at, for example, the number, like we are approaching 3 million vaccines in the world. Dr. Adima will confirm. I'm sure some of us are doctors here as well. I received my both vaccines. So basically, what may happen is actually causing some. So for the allergic reaction, which is a quick one, is very rare. Number 2 is actually when we develop immune response in our body, we can get fever, shivery, low-grade fever, but getting a bit body ache, which wears off from 24 to 36 hours. And these are the side effects we have seen. We have not seen in Pfizer, 16,000 Moderna, and other vaccine.
Thank you, Doctor. Thank you. I have a question from Brother Farhad Shah from our Facebook audience. Brother is asking, first we were told first dose, then second dose after 2 weeks. Then suddenly told second dose maybe 12 weeks. Is it possible that this may be less effective after 12 weeks rather than 2 weeks?
I think it was more 3 weeks. That's how because that's how the trial was done. So they gave trial day 0, and then day 20, 21, up to 21. That's when they gave it. So that is how they marketed it. However, again, this is a controversial thing, because ideally we would like the evidence to be translated as it is. So if it was done, a study was done like this, result was got like this, We want the people to receive it. When it went to the JVCI, which is the authority which advises on vaccines, they said, well, actually, what we also are seeing that when the antibodies are developed on day 12, they persist for a longer period of time than just 21 days. So we can actually inoculate vaccine in more number of people in the next 3 months, but definitely up to 3 months, people can receive it because this is the time. And how did they do that? Because when they saw the people who were developing antibodies as a reaction to the virus, like myself, I got antibodies when I had the infection. And then up to 4 or 5 months, I saw that antibodies were sustained. And after that, it started decreasing. So said, well, actually, we can do that. Again, they are the experts. Like Maulana kindly said that actually we are referring to the experts. So there is a bit of tussle between the two. So there is a theoretical possibility it will go down, but the JVCI people who are the experts on these actually, but looking at the other studies, we haven't seen that antibodies, once they develop, they go down so quickly. So that's why you can give it in 3 months' time. That's what their suggestion is.
Thank you, Doctor. Meanwhile, we have some brothers who have raised hand from this forum. I will ask admins, Brother Amir Raza or Brother Abid, if you allow our brothers from this forum, if they want to ask questions, Brother Ali Hasnain or Brother Ali, they are raising hands.
I think Brother Abid can allow them, yeah.
Yes, Brother Abid, if you allow brothers here who are raising hands, if they want to ask questions, Brother Ali Hasnain.
Assalamu alaikum. So I am from Ireland, Republic of Ireland, and I'm a data scientist myself. So I having a very brief question. I actually have two. So first of all, as Dr. Kamar said in his initial discussion that he's an empirical person and he rely on data. So that's very good. So is there sufficient data or data like with reassuring results that with regard to the safety that we can rely on at this moment? And what type of, because like when you publish any research, so what type of, you say like the group of people, they have all the experiments done. So we can directly, at this stage, we should wait for some time, or you think like this is the right time to start getting vaccination? This is the question number one. And very briefly, are you seeing a lot of vaccine hesitancy in doctors or medical professionals? And if so, is it justified or, like it is unwarranted concern? So these two questions.
Sorry, can you repeat the second question? So are we seeing a lot of doctors doing what?
Yes, say medical professions having the vaccine hesitancy, or are they have the justified concerns, or it is because like some of the doctor I know here, even they're working as a consultants, they are saying like this is not the right time, and they are thinking to delay it a little bit until unless they have a clear I don't know, results or something like that, then they will go for it. So do you think it is the right time, and the hesitancy by the doctors and the medical professionals are justified, or it is unwarranted at the moment?
Okay, thank you so much. This is very, very good questions, all of them. Let us go back to the first question. Have we got the sufficient data about the reliability of the safety of the vaccine? And it is the right time to start. I think if you remember, the vaccine group started meeting in February, but April was the time when the trial really started. And then in the last 2 months, we got the results. We have actually got 44,000 in one only, and then others. Firstly, our question is, if we go into the detail of the vaccine, again, I was not an expert at all before it got, but with my head of medical director, I received so many of the different presentations. So one thing which I got to know is actually the trial itself would not take much time. It is about getting all the resources together, the number of people involved together, and to recruit people together. That is what was taking time. So it was only 15 people who were actually recruiting so many people. Now we have got 15,000 people recruiting in different countries. So second question, is it safe enough? Well, actually, if you look at all the other studies of the vaccines, like MMR, like DPT, like polio, the data was collected on a short period of time. Why? because we know that once antibodies develop, they were not having a long-term effect on these people. So if those studies, we are happy to have MMR. And for example, hepatitis B vaccine, if the doctors, all of the doctors will have it, the data was collected from the participant. I'm not saying that whole of the study, but it was only followed for some very brief period of time, which we have already done, number one. So we basically know that this is the model which all the trials of the vaccines have followed before as well. So it's nothing cutting corners short. Number two, that actually it's not just about the people, the individuals involved that we are studying. We are in an era where lots of, I know that there are some technological people sitting here, there's a lot of digital mapping which was used, that how the vaccine will behave inside the body after it is injected. And that is how they actually predicted the modulation inside the body. So it's not, so they don't not only looked at the humans being involved, but also the digital mapping of it. So when you said about the medical professionals getting hesitant, we live in a world of 7 billion, and we all have to assess the things properly. And I'm with all, definitely I will respect my colleagues who will have some more knowledge about these things. What I actually do follow that if you look at every single medicine Nobel Prize winner, they have written a statement of trust into these vaccines. And so every living medicine Nobel Prize winner has written it. Most the academics which have been involved, because if I'm a clinician, it's hard for me to actually look at the research models and follow that. But which are the primary research universities, then the environment is much more different to our own case. We both are important, our both roles are important, but we are looking at these people who are informing us on the models of researches. So if you look at, for example, in my trust, actually tomorrow we are finishing the first lot tomorrow, so on Sunday, and I have not seen actually, apart from those people who have got the history of allergy, and like for example, I've got people who are pregnant, and because the data is a bit scanty in the pregnant ladies, because it was never researched anyway, or breastfeeding mothers. Apart from that, I did not have a single person from the whole of the trust who actually turned it down. And this is the data I have firsthand. So even this morning, actually, I'm getting text now about the vaccination which is going on in the trust. And we are seeing not the hesitancy as such, but I can understand in some areas there is. The important thing is also for them to speak to the academics of their area, because as a clinician, we also have to rely on the academics and the researchers. I hope it explains the answer.
Thank you, Doctor.
Can I add something?
Yes, yes.
Although the answer is quite perfect by Dr. Kamar, the gentleman, Ali Hassan, I think, asked the question about the data and some professional people is avoid. So I know some people as well in my hospital, they are not satisfied that it's quite early to take this vaccine. But the thing is that I say there is a proper science for the vaccination trial, preclinical, clinical, and after clinical trial number 3, phase number 3, this vaccine is go. Any vaccine can go. You know, there is a phase 4 as well. The phase 4 is that we are apply this vaccine, and if something happened in days, years, and we have to feedback that. This is the science how they work. Even some medicine we are taking for a long time, but if we give the feedback, some side effect and other thing, so they will consider. This chapter is never closed. So it is quite safe to use it. I don't know who has a knowledge and do not go for this vaccination is a quite surprise for me, but those who have not inside that, so this is a very relevant question. So I'm saying we are in phase 4, and things the other vaccine is still in phase, they give the feedback. So just like the Ebola vaccine, which is quite effective, just 3 years back, swine flu vaccine, they are most effective. They also use in the phase 4. So my answer is that it is quite safe to use it right now.
Thank you, Doctor. Thank you. Can any of the admin please unmute Brother Ali? He has raised hand for some time now. Brother Ali. Yes, Brother Ali, please go ahead.
Assalamu alaikum.
Alaikum assalam.
First, well, I've got a few questions. The first question is, I mean, I had coronavirus myself, so I'll come on to that a little bit later on why I'm asking the question. The first question I have is that obviously everybody's been made to, we're thinking that, that this disease is a very dangerous disease and a lot of people are dying from it. But I was watching the BBC Parliament debate the other day, and the Prime Minister was saying that only 400 people under the age of 70 years old have passed away without any underlying health conditions. Is that true?
So 400 people under the age of 70 years old, and sorry, did you say that without underlying?
Yes, without underlying conditions.
Yeah, it is low, but for a medical scientist, it becomes very important that 400 people are dying where we do not know why they died.
But the fact still remains that only 400 people under the age of 70 have died since the start of this outbreak. That's still a fact. How many people? And again, a BBC report yesterday was saying that 50% of all the deaths have occurred in care homes, in a care home setting. Is that correct?
I will doubt that. Data is all available actually on ONS sites. So,
I mean, obviously, I'm worried about us catching the virus. So, if half the deaths are happening in a care home setting, which is a setting which is protected from general public, then obviously that's something to consider, isn't it? Because I want to move on to my next question. If we take the vaccine, will that stop us from endangering somebody else? Will it stop us from passing the virus on? So does it make us, are we still infectious, or are we not infectious anymore? Can we still transmit the disease?
Okay, let me say that in as simple words as possible. First of all, the evidence has been collected on that when after receiving the vaccine, you receive the virus in your body, it's not going to cause harm to your body. So basically, because you will have antibodies in your system.
Yeah.
Now the theoretical thing is that actually, if the virus enters your body and it cannot affect you, but can you transmit it back to somebody else who is vulnerable? The answer is that actually the real answer we do not know. The theoretical answer is that we will, by having the vaccine, we would have blunted the virus in its pure form, so that even if it is transmitted back, it will not be as dangerous to other people as it used to be without it. Okay, so that's the theoretical, but that's not what the research is done on.
Okay, so I mean, and again, the reason why I'm asking that question is that one of the things that the government are saying, and one of the pressures that we're feeling, for example, we're locked down because we haven't got access to employment, or employment has been reduced, or people are being made redundant, and all the.
Brother, we may come back to you because we have other brothers. They're waiting.
Okay, just one final point.
Please.
The last point, because I had coronavirus myself, I was reading a New England Medical Journal peer-reviewed study which says that once you've had coronavirus yourself, you are immune to catching it again, or if you catch it again, you don't get it as bad, but you're not a transmitter, and you're okay. So if people have already had the virus and they've come through the other side and they're okay, then what's the need for taking the vaccine?
It's a very good point, because just like you, I had it and I had it bad, and like you will relate to me and I will relate to you that how poorly we felt and how much oxygen and everything. The point is that when I was part of that study, as I said, it was called Sirens study. The study was done over 6 months. So we know that over 6 months, the antibody was positive. So for 6 months, you were immune. But at the end of 6 months, what they started seeing in a significant number of people, that the titers of antibodies started going down. And this is where the vaccine comes in.
Well, okay, that's not what the peer-reviewed study says. It says that the T cells that you've got give you immunity for up to 10 years. Because
that's exactly, that's the theory, that because the pattern they have seen, the digital map they have seen. Did you read all the charts on it? Did you see that?
I saw everything, and that's what I'm saying is that the evidence, and there's an NHS study being done of 12,000 NHS, and the finding that actually the body itself, your antibodies reduce anyway, because your T cells are the cells that remember what the virus is. So your natural antibody levels will come down, but that doesn't mean you haven't got protection. You have got protection by your T cells, and you see T cells that are key, and they are the ones who reintroduce the antibodies if they could encounter the virus again. Your body would be wasting energy and resources if it was making antibodies for the virus that it hasn't got in its system. So the report, and I'll just put it into the chat box for everybody to look at. It's a peer-reviewed study by the New England Medical Journal. It's in there, which says that we are protected. So if, as we say, there's a large number of people who've already had the virus.
Really, we have only 4 more minutes, so I will, because I have quite a few questions still waiting. And
so the question is that is the vaccine absolutely necessary for everybody?
I think I will just add that because as Amir Raza here, I've just looked at the study. Obviously, there's no time to discussion, but that's the result you are concluding from that study is not correct. Study says about 6 months actually protection, and there is no study to say 10-year protection.
For
so
the
this whole
idea
is incorrect. But again, it's difficult to discuss these details and data in this topic. But thanks very much for your contribution.
Thank you. We will move on to next question. Question is for Dr. Hadi Imam. I have heard that there is ethanol in AstraZeneca vaccine. What is the background of that? Doctor, you're mute.
Yeah. Sorry. So yes, ethanol in the Oxford vaccine, but it is changed its form, and company it show, and even the company take the fatwa some people regarding the ethanol changed the shape. So ethanol is present, but it changed its shape. It's simple.
Okay. All right.
Yeah.
Maulana, anything you can add regarding ethanol? Maulana Hurshibiri, if you're still there. If there is any quantity of ethanol, is it any problem?
I don't think that there is any problem, but I have to check if there is any, religiously any fatwa from Maraji. At the moment I'm not sure.
But even though if it is for any disease or treatment purposes, is there still problem with that?
If there is anything that involves any najis objects, then of course it's going to be problematic, unless if that is being given to the children or not elders.
Okay, right. We'll move on to next question. Okay. Can we order food from restaurants? How likely is to catch the virus as we touch the packing and eat the food? Then does it make a difference to bring the food and cook it again or for a few minutes to kill the virus? Any of you doctors? Maybe Dr. Kamar? That if you buy the food from the restaurant, like what are the possibilities that there is a virus?
The public health paper, I will struggle to answer this question in the recent terms. So the last one which I had seen, which actually told us how the virus was transmitted and in what form, it actually clearly did not indicate that actually it was being transmitted through the food. So and that was some time back, I must say. As we know that actually even if it is in the public places, it is transferred, the route of transmission remains respiratory. So it is not about doing, like for example, eating and drinking. The question could be that actually it is a container and we should be washing our hands and serving it. So food itself is not an issue. It's about the container which arrives, and we should be cleaning and keeping our hands clean so that we inadvertently do not put the hand to the mouth and then inhale it. That's a report I remember, but that was some time back.
Thank you, Doctor. We're going to take the last question. Huawei Y62018. Any of the admin, can you unmute Huawei for Y62018?
Yeah, we have unmuted him now, so he can unmute himself and then join in.
Yes, brother, you have raised the hand. You can ask the question. I don't know your name. It's coming up only your mobile phone Y62018.
Yeah.
Yeah, I think it's coming up now.
Okay.
Yes, brother, you have raised hand. You can ask the question if you have any question.
Okay, maybe then I can ask if there's no sound there.
Yes, please.
Question to our, I think we can ask Sayyid Hadi and Kamar can also answer as well. We have heard a lot of variants now, the UK variant, South African variant, and now Brazilian variant. And the last news we have heard about Brazilian variant is that it may be quite dangerous in terms of vaccine may not be effective, or even people who had previous strain infection may get reinfected. Any views about it or any new thing?
The news about, thank you so much, Brother Ahmed. There is no detail on it, so I really can't answer the question. We have read about the South African and the UK, which was the Kent, as they called it, the variant. We also have to remember when we were looking at the report, and you will understand yourself that we are actually have identified 24 different genotypes of measles. So there are different variations of all the, that's what viruses do. They mutate, they change, they try to fight back when they do not are not able to penetrate and within the body as well after entering. I think the key here for scientists who are more clever than I am are actually to look at the structure of it, which part is mutating and how is it causing harm, and try to come up with the answers to that. We know that so far their ruling, we use for ulama, but their scientist ruling is that they're good at dealing with South Africa and the Kent one. I personally haven't read anything about Brazilian, so I can't really comment.
Thank you.
Sorry, can I add something here?
Yes, please.
Yes. As the Dr. Kamar mentioned that we don't know about the Brazil. Rest are covered with this vaccine. Just let me give me some example. Just for example, we go for the flu vaccine every year here, and meningitis vaccine. So virus has the his properties that they change the shapes. This is very common. So almost every year, sometimes the few years, the vaccine available in the UK, there is some alteration because the virus changes. So maybe in future, there is some changes in the corona vaccine. It is not ruled out. So it's a very common, but right now there is not a big threat.
Thank you very much. Thank you, brothers. We are already 15 minutes gone over our time. We were planning to finish off this program at 3:30. But once again, thank you very much, Sheikh Ghulam Hur Shabiri, Dr. Sayyid Kamar Abbas, and Dr. Hadi Imam for your time and informative talks. May Allah subhanahu wa ta'ala bless you all. I would also like to thank all the Imamians UK volunteers and all the participants and your active participation who made this program a great success. Before we request Sheikh Hur Shabiri to make dua, I would like to request you to like our Facebook page. And I would urge you all to get, and in that case, you will obviously get the notification about our next coming programs. We would also appreciate your feedback, and what is also important for us in that feedback, that you need to propose what sort of program topics would you like to hear from Imamians UK in future seminars. Now I would request Sheikh Hur Shabiri to make dua. Thank you very much for joining us, and see you all inshallah in the next program. Thank you. Jazakallah. Maulana Ghulam Hur Shabiri Sahab.
Bismillah ar-Rahman ar-Rahim. Before we close that, I would like to request that if there are any questions, please, as the Facebook is being provided, you can send. If there are any religious questions, we are going to answer for that. And you can send to Imamians. Through that, we can get those questions as well. And I would also like to thank Imamians and our dear doctors for giving their time today. It's very tough time for them. I know that they are very engaged in the hospitals. So let us recite dua for Imam of the age altogether, inshallah, for the reappearance of Imam. As you know, time is becoming difficult, and as we face difficulties, we need to ask for Imam. اللهم صل على محمد وآل محمد بسم الله الرحمن الرحيم اللهم كن لوليك الحجة ابن الحسن صلواتك عليه وعلى آبائه في هذه الساعة وفي كل ساعة وليا وحافظا وقائدا وناصرا ودليلا وعينا حتى تسكنه أرضك طوعا وتمتعه فيها طويلا برحمتك يا أرحم الراحمين. For those who are suffering in the sickness, illness in these days, please recite 3 times Amma Yujib. Bismillah ar-Rahman ar-Rahim. أمن يجيب المضطر إذا دعاه ويكشف السوء أمن يجيب المضطر إذا دعاه ويكشف السوء أمن يجيب المضطر إذا دعاه ويكشف السوء اللهم صل على محمد وآل محمد. And finally, those who have passed away because of the pandemic, please recite Surah Fatiha for the souls of these marhumin. Bismillah.